Okay, we are now live. This is Senate Finance on February 14th, Valentine's Day. And this afternoon, we have actually three witnesses. This is on AAS 230, the Medicare Advantage and Supplement Insurance Plan that we have. And our witnesses today are from America's Health Insurance Plans. And they're going to talk to us. And I've got Sarah Lynn Geiger first, but if you have a different order you'd like to go in, this is your show, but if not, I will start with Sarah. And Sarah, we just ask you to introduce yourself for the record and who you represent, what is AHIP might be helpful for us to know.
Sure. Thank you, Chairwoman. Can everyone hear me?
Yes.
Okay.
For this end.
Great. Thank you, Chairwoman. My name is Sarah Lynn Geiger, Regional Director of State Affairs for the Northeast region, which includes Vermont, here at America's Health Insurance Plans, or AHIP. AHIP is a national trade association representing insurance carriers, the payer community. We represent the industry. So I know that you've heard testimony on this bill and certainly others from individual health plans, but we represent kind of the industry as a whole. And I'm joined by two of my colleagues here today, Megan Stringer and Lisa Asatorian, who will expand more on the Medigap plan policies and the Medicare Advantage plan policies, which this bill impacts. So I'll just do a quick introduction. We really appreciate the opportunity to testify here today on our concerns on Senate Bill 230. The committee has been incredibly generous with their time to engage with us on this important conversation. AHIP is intended here to not only provide our concerns, but also engage in a conversation on the bill. We hope to be a resource for you all and how this bill impacts our industry as well as patients and consumers, and this bill in particular, the senior community and the Medicare community, those that use Medicare plans. So we've submitted some written comments. I'm not sure if you have them yet or we'll submit them after, but we hope that our testimony here today.
On our website.
I did not get them.
Okay, we haven't gotten them yet.
Okay, I'll make sure.
After they get sent, we post them on our website so the committee can read them and go back.
Absolutely, I will make sure that happens. So this here today is to provide some additional information in addition to that written testimony, and we hope that we can expand on those comments, answer any questions that the committee has. I've listened to some of the previous testimony that you all have had on this bill, so we hope that we can provide some additional perspective on what you've already heard. So now I'm going to turn it over to Lisa Asatorian here at AHIP. She's the Vice President of Federal Programs, and she's going to discuss the provisions in the bill that impact Medicare Advantage plans.
So thank you, Sarah. Good afternoon, everyone. As Sarah mentioned, my name is Lisa Asatorian, Vice President of Federal Programs at AHIP. Thank you for the opportunity to testify on Senate Bill 2030. We are very concerned about the Medicare Advantage and Medigap provisions included in the bill that we believe will adversely impact individuals in Vermont who are eligible for Medicare coverage by limiting their access to affordable, high-quality Medicare coverage options, including extra benefits that are available through Medicare Advantage plans. As Sarah mentioned, we had an opportunity to listen in yesterday on the discussion on Medicare Advantage and Medigap coverage options. So we'd like to start with clarifying some issues that were raised that were helpful to hear yesterday, that Medicare Advantage plans are required by federal law to offer the same benefits covered by traditional Medicare. Medicare Advantage plans offer additional benefits that traditional Medicare does not cover, such as a cap on out-of-pocket costs. Plans also provide vision, dental, and hearing benefits, and plans may offer comprehensive prescription drug coverage. So Medicare Advantage plans have to offer the same benefits that traditional Medicare offers for inpatient and outpatient services. So Medicare Advantage plans can't offer less and actually offer more benefits. So we hope that clarification is helpful to the committee members.
We have a question. Just
yes.
Is there a place where we can compare denial rates between Medicare Advantage and traditional Medicare?
At this point, I'm not aware of anything publicly available on denial or other types of data to that extent. However, just to let you all know, CMS did the Centers for Medicare and Medicaid Services, that's the federal agency, CMS, that oversees the Medicare Advantage program, recently finalized a rule where I believe in a couple of years, statistical information related to denials, prior authorizations will be posted on an annual basis on plan websites. So we can definitely provide you more information about that information that will be publicly available pursuant to a federal agency rule that was recently finalized.
So
In a couple of years.
Yes.
Okay, I think that's the end.
Thank you for that question. Another issue we wanted to mention is that when it comes to providing health coverage for state employees, states can work with Medicare Advantage plans on the specific design of the plan that they would like to offer to eligible employees. So we think that's an important issue to keep in mind. As for other Medicare eligible individuals in Vermont, there is an annual Medicare coverage enrollment period that runs every year from October 15th through December 7th, when individuals eligible for Medicare coverage can select a different Medicare Advantage plan. And there's another enrollment period known as the Medicare Advantage Open Enrollment Period that runs from January 1 through March 31 each year, that enables anyone who elected coverage with a Medicare Advantage plan but wants to switch back or wants to change plans or wants to go back to traditional Medicare. They can do that during this annual Medicare Advantage Open Enrollment Period. Again, that runs from January 1 through March 31 each year. And the Medicare rules also have special election periods for other events or circumstances that, we see in the commercial market. For example, if someone ends up moving outside of the service area. There's also a special election period in the event someone has elected, felt pressured, frankly, to switch out of a Medicare Advantage plan. They want to go back to their old plan. If they feel that, they were pressured in some inappropriate way, there is a special election period that CMS does provide for those unique circumstances, and enrollees can reach out to CMS, the federal agency that oversees the Medicare Advantage program, through 1-800-Medicare to file a complaint and to have CMS address their concerns. Now, Medicare Advantage and Medigap coverage are different and are designed differently. So my colleague Megan Stringer will discuss the Medigap coverage with you in more detail, but let me close by saying that, we have concerns with the language in the bill under sections 3, 5, and 6 that would prohibit the inclusion of Medicare Advantage plans in the health coverage for state employees and would limit the advertising and sale of Medicare Advantage plans in Vermont. As I mentioned, the Medicare Advantage program is a federal program and it's governed by federal rules. The Centers for Medicare and Medicaid Services, CMS, is the federal agency that has oversight and responsibility over the program and the plans. And the concerns that this bill is trying to address on the advertising and marketing of Medicare Advantage plans is being addressed by CMS. CMS has increased its oversight and has imposed additional restrictions on marketing to protect Medicare enrollees throughout the country from misleading and inappropriate marketing activities. So, for example, CMS now reviews and must approve all Medicare Advantage plan TV ads before they go live. So we've all recognized that the language in the, for example, the Joe Namath ads has changed. We are concerned that the provisions in the bill 230 on Medicare Advantage, our concerns are that they would conflict with these federal requirements. And given the current extensive federal scrutiny and recent increased oversight on the marketing and advertising of Medicare Advantage plans, we believe these provisions in the bill, while well-intended, are not needed. We are also concerned, again, ultimately our concern is, these provisions limiting Medicare Advantage plans being offered in Vermont would ultimately deprive individuals eligible for Medicare coverage in Vermont the choice to obtain coverage from an affordable, high-quality Medicare Advantage plan that could also provide them with extra benefits that are not available under traditional Medicare. So, thank you again for considering our comments on this bill, and I'd like to turn it over to my colleague Megan Stringer to discuss the Medigap coverage we think is also important for you all to consider as well.
Before we switch,
Yes.
Senator Hinsdale, you had a
Yeah,
question?
specific to Medicare Advantage, I was just wondering if any states go further in regulating information and advertising beyond what CMS does.
That's a great question. Not that I'm aware of. And again, I believe it's because of the jurisdiction, the Medicare statute, and because of federal preemption. I'm not aware of seeing any other states, considering laws that would limit any activities under the Medicare Advantage program.
Okay, I assume if you are offering more benefits than Medicare at a lower cost, that you've got, because if you're paying for my dental and my eyesight, you've got to be cutting corners somewhere. I've heard that some Medicare Advantage plans pay less than Medicaid to places like nursing homes. Do you know how your rates compare?
It's an excellent question, and I think what you're referring to are the the contracts between the Medicare Advantage plans and the providers in the community where they're providing services to Medicare Advantage enrollees, and those vary. Those contracts vary. Medicare Advantage plans also are leaders in value-based contracting. And that's exactly, I believe, what you're referring to is their value-based contracts with providers in their communities that they contract with, and those vary. And under the Medicare statute, providers and plans have that flexibility to negotiate contract rates and to pursue value-based arrangements. And so, those contracts vary. If there are providers out there that are concerned about, the rates they're being paid, they're under the Medicare statute. The Medicare statute does provide that flexibility for plans and providers to negotiate the rates for the services being provided.
And if I could just add there, I just wanted to provide some context. We are a trade association and we are bound by antitrust guidelines. So I understand your question. It's an important question, but we can't, with our members and as a group, discuss reimbursement rates. We're prohibited to do that. So totally understand your question, but unfortunately, we do not have that information other than anything that's publicly available.
Okay, any other questions? If not, we'll go on to Megan Stringer.
Yes, thank you, Madam Chairwoman. My name is Megan Stringer. I am a Senior Policy Advisor for Commercial and Product Policy here at AHIP. And Medigap is one of the product lines that I cover. Thank you so much for taking the time and setting aside some time today to hear from not just myself, but from my colleagues to talk about the importance of ensuring that seniors have access to affordable coverage choices for Medicare and any supplemental plans that they would have in addition to that. Medicare supplement or Medigap is a really unique product, I think, in the health insurance marketplace. Unlike Medicare Advantage or even under 65 commercial major medical insurance, those two product lines are valued and structured on an annualized basis. The benefits, might be added or changed from year to year, and the premiums are set annually. And they look at what the projected costs will be for the year ahead, and that's how those premium costs are set. In contrast, a Medigap plan is structured actuarially, and the premiums and benefits are set on on over the life of the product. So from the time a senior first starts on Medicare, for most that will be 65, throughout their whole life. And the premiums reflect that. And so when we talk about the importance of paying into the risk pool in the Medigap Medigap program, that's fine. Is that it is really a much longer term product than an annualized product like Medicare Advantage or under 65 comprehensive insurance. And part of the reason for that is Medigap is a guaranteed renewable product, which means that once a policy holder purchases their Medigap policy, the carrier cannot cancel that policy for any reason unless the person decides not to pay their premiums. So the benefits can't change. That is a contract that is set again for the rest of that policyholder's life. And that is how that is structured. And it is very different. So if you're talking about a Medicare Advantage or an under 65 comprehensive major medical plan, again, annually structured. So it seems reasonable then to have an annual open enrollment period. However, for a Medigap plan, which is structured over the life of the product and is not intended to be changed, and in fact can't be changed from year to year by the carrier, then an annual open enrollment period becomes much less reasonable and much less workable and operational for that Medigap plan. I also want to highlight the value and satisfaction that Medigap enrollees find in their coverage. AHIP every other year surveys Medigap enrollees. So from all over the country, without respect to which carrier they have, we have 93% of Medigap policyholders who are satisfied with their coverage, and 80% of those are extremely satisfied. So this is a very popular product. People really enjoy and like this product. And I think important in considering the value of Medigap for policyholders is that 91% of those seniors surveyed said that they would be concerned about losing their financial security if they were to lose their Medigap plan. And so when we talk about our concern for existing seniors who have Medigap plans, and of course we know so many seniors across the country are living on fixed incomes. And of course, prices are going up for everything from groceries to gasoline, across the board. And if you've got a fixed income, that makes increasing premiums on your health plan really can make you face a stark choice. And so when we talk about that, that is the reason that we really want to drive that point home for you, to really understand. We're talking about, I believe it is in the 48,000 Vermont seniors who have Medigap plans. Additionally, our concerns specific to S230, the bill that you have before you, is Section 4. The annual guaranteed issue and open enrollment period into Medigap plans for Medicare Advantage enrollees specifically. And yesterday, the representative from Blue Cross Blue Shield of Vermont mentioned a previous study about the premium impacts of an open enrollment period. And I think that was a more general birthday rule, as some of these are called. And about the impact that would have on seniors and Medigap policyholders' premiums. We echo those concerns and really want to highlight additional recent actuarial studies that demonstrate the same issue in states where these birthday rules have been passed and implemented. I think the number is in the number of states is maybe in the 15 range. It's a little hard to pin down because every state's Medigap statutes are widely variable from each other. But we do want to really underscore and highlight this fact that in particular, this birthday rule open enrollment period will create an adverse selection problem in Medigap in Vermont. Because what you will see is a delay of purchasing Medigap plans until someone is sick, or they will purchase a lesser plan and then scale up that coverage when they get sick and then drop right back out of the risk pool, knowing that if they were to get sick again, they could go right back in. And it was very helpful to hear the representative yesterday talk about the price differential for their completely open Medigap plans versus their more traditional structured Medigap plans. And I think you can see the month-to-month difference that could really have on a household. And that is very much our concern. You talked yesterday and discussed with her some of the concerns about the risk pool, and what we are seeing in some of these states where birthday rules have been implemented is not just an increase in premium costs, but also we are seeing carriers exit the market. That is just that is what has been observed in these actuarial studies, the number of carriers offering plans and the premium costs themselves, and of course, comparing that also to other states. Again, our concern with this birthday rule is the adverse selection problem. We would ask that you remove Section 4 from the bill entirely. And we do have some alternatives to offer. If you would be interested in those, if you do decide to move forward with this bill. And I'm happy to take any questions if you have them.
I think this bill has two problems. One is we've had hospitals and I've got nursing homes coming in, is the payment or the ease of getting payment. It's much harder to get payment from some Medicare Advantage products than from others. And if we don't accept those programs, we've got a whole lot of people in this state who can't get health care. But the other one seems to be the ability, if you are very happy and you sign up at 65 and now you're 85 and you've been playing in over 20 years, but now you need heart surgery. And the nearest surgeon in your list, your network, is in New Hampshire or over in Albany, New York. They may want to switch back. And the issue that I've heard is that the cost of switching back is prohibitive. And that again gets to, because in this state, when you buy your first Medigap, you are community rated. There's no health, there's no physical, it's guaranteed issue. When you wait till you're 90 and there's adverse selection, we're trying to keep the cost of Medigap down, and the more risk it takes, the more it costs. And it's trying to figure out, we heard yesterday that Blue Cross does offer a guaranteed issue. It is 20% more expensive because it's got 20% more risk. Their actuaries have figured. But it's the ease. If you decide you don't like your plan, it's the ease to get out of your Medicaid Medicare Advantage and get back into regular Medicare. And the real roadblock seems to be the cost of getting supplemental insurance, which means you're gonna get hit with a really big hospital bill if you don't have it. But I also understand the need, you have to cover your risk. So that you can pay what's due. And I'm just wondering if you could help us think of any way to make that easier. If,
So one thing that I think you talked about someone who selects an MA plan and pays the wording that you used was they pay into the system. And so again, you know, I want to highlight the difference between Medicare Advantage and Medicare Supplement. So, you know, if Medicare Advantage is on an annualized basis, then you're really only paying into a 1-year risk pool. And then that resets every year because that is how the product is structured. Whereas with Medicare Supplement, if someone joins at 65 and they are still paying in at 85, they really have been paying into that same single risk pool for the entirety of that 20 years. You know, does that kind of help you understand the
I
difference?
understand why that happens, but you've got somebody that wants to come back to regular Medicare. They, for whatever reason, the Medigap is much more expensive to get, and I understand why. But I think that's the roadblock to switching that we've been trying to figure out. I think a guaranteed issue is something, but it is likely to be prohibitively pricey for some people.
Well, and you know, you mentioned the other product, and I think she said for Plan A, the price differential was about 20%, but then when you get into the F and Gs, the price differential is about 50%. I would have to go back and double check my numbers on Vermont and which plans seniors are enrolled in. But you know, that 50% price differential, I definitely understand and hear your concern on that. But we are also concerned about current Medigap policy holders who bought their policies with an expectation of affordability that are going to have those promises broken. And we are extremely concerned about those policy holders' financial health. I do want to turn things back over to my colleague, Lisa. I know she has to jump for another meeting. So I think she had a couple of notes that she wanted to make for you.
Okay, good. Lisa, welcome back.
Thank you so much for your thoughtful questions. One issue that I wanted to share with you all is part of the Medicare Advantage program. There are really strict network adequacy requirements. These are time and distance standards that Medicare Advantage plans have to adhere to ensure that their network is robust to provide the medically necessary services under Medicare. And so that is something that plans have to make sure they're complying with. So if there is an issue or circumstance where an individual, you know, feels like they're being compelled to travel long distances, I mean, that is an issue that the Medicare Advantage network adequacy requirements protect against. And so we just wanted to make sure that you all were aware of that there are very stringent time and distance standards, and there's some additional beneficiary protections. So for example, if there is a medically necessary service that needs to be provided and the plan for whatever reason does not meet the network adequacy requirements, the plan is obligated to provide those services through an out-of-network provider at in-network cost sharing. So that's another protective measure within the Medicare Advantage program. So I hope that's helpful for you all to consider.
Okay, any questions, committee? None. Okay, thank you for taking time to be with us today. It's helpful. We've been trying to get someone that does Medicare Advantage talk to us, so it's very good to have you here, and thank you very much. And if we have any questions, we'll get them to you.
Thank you so much.
Thank you so much.
Thank you.
So, Senator McCormick, can you turn the lights on?
Sure.
getting cloudy and therefore dark.
Seems to be the nature of modern work, that when you have remote meetings with people, they're in completely different places. Like,
Oh, yeah.
not like 3 people in the same office all week.
Did anyone else notice something that I noticed about the woman at the bottom of that?
But you are on
Yeah.
television.
I think that was not her blouse.
Was
Something on the screen.
No,
She moved and you.
Yeah.
moved.
You know, to do the background, I agree. It looked like there was also like a blurred front.
Yeah.
Yes, well, I mean, a lot of people have a fixed back.
Oh my God.
okay.
I did notice that as well.
Yes.
Bill, we're gonna have to decide what we're gonna do. I think maybe we'll try and get the sponsors who you were sponsored.
Yes, well, and I've
And Wendy was.
And I think Zane said that some of the witnesses I've invited on Friday,
Okay,
that are physicians and nurses who.
actually one of them's coming in today at 4.
okay. Yes, Marvin Malik. All right, that's what he's on. Okay.
So, right, I mean, we don't have patients, I suppose, but they're pretty close to seeing who gets denied and.
Well, I think, yes, you're paying less and getting more, which means they're cutting something somewhere.
Right.
And
More on paper.
yes, and
Yeah.
so yes, they're probably gonna deny more. They're probably going to. The complaints I've got is that it's like pulling teeth to get payments out of them for the hospitals, whereas if you put in a Medicare claim, it's just paid and for these. But it is cheaper insurance and for some people, that's what counts.
I mean, when I read between the lines, that's the truest piece of all of this is people are required in many contexts to have insurance. They want something even if it's catastrophic. And so, you know, we wouldn't want to do anything that means people can't have health insurance in a very broken system where it would be nice if we could put more protections around Medicare Advantage, which is clearly not playing by the same rule book.
We don't allow insurance to get advertised, or at least it's not advertised very often, right?
Oh, I guess that's one of the major questions is there, has there been, because part of this is history now, sufficient disclosure for people to have the information that should alert them to what risks they're taking, or should there be some additional disclosure requirement in Vermont?
Right.
If you take a plan like this, what the issues are, and then in terms of pulling teeth to get paid, are there problems regarding any particular carriers not paying in a timely fashion? And again, I'm assuming that also is something that's regulated and that DFR has an ability to step in on if necessary.
Emily is here, and Berkeley isn't here, we're 10 minutes ahead, so Emily.
Sure, something I feel like would be useful to ask more questions of our previous witness.
Well, we can get with the SCA of this. They were quite
We have
exercised.
invited them. They have not responded. I have heard through the grapevine that they're very happy with what they got negotiated last year with when a Medicare Advantage was being imposed on them. And they don't want to upset, I would assume that they might, I would, if I were a state employee, be a little annoyed at being told never at any time can I do this, because you may well for a large group be able to negotiate something, perhaps with a local insurer.
So they don't even want to come in and say,
They have not,
we don't like this
they
section.
have not responded, right?
Email, another email, their main contact is never.
Yeah.
So we can do with that as we want. But they haven't come in and say, no, never, don't ever let us do this. Okay, so Emily,
Yes,
a lot of concern about
yes,
how much you can do. Most of these we've been told are federal.
yes.
But, and so there's some limits on what we can require in advertising. This also says that brokers can't take commission. And to me, the brokers are the one place where we can personally.
Yeah.
Make sure that people know what they're doing,
Yeah.
know what they're getting.
So I'll just start out by saying, generally, for Medicare Advantage plans, we are preempted by federal law from regulating the advertising. Doing anything around claims processing, to your comment about, how they're paying. We also can't control the commissions that the brokers are paid, so that's all in
You
federal.
can't say you can't take.
We can't say that.
Okay.
What we can do, so we license Medicare Advantage insurers who operate in our state. They're required to be licensed with the state. And then we also license the broker community. So, just this past weekend, I was at a meeting and I was talking to other states about what they've done around Medicare Advantage. And one thing that we could do, because a lot of the concern is around advertising, right? Misleading practices and maybe telling, policyholders something and getting them to leave their Med Sup plan or,
Yeah,
now,
now,
all
I'm telling
sorts-
him it's gonna be very expensive to get back
right.
Medicare.
Right, exactly. So one thing we can do is while we can't regulate the rules that they have to comply with, we can hold them to a standard of if you're not following those federal rules, because we license you, we can then hold you accountable. So essentially be saying, if you're gonna be licensed with us, you have to, you have to comply with these federal rules, and if you don't, it's kind of like you're incompetent or you're not, that's the wrong word, you're not following, you're not operating.
Would your license maybe be at risk?
Correct, exactly, yep. Other things states have done is put out guidance, right, put out kind of consumer information to the broker community, as well as to consumers. So we are I feel like I sound like a broken record, we are in the process of trying to set up a Vermont specific webpage that would be run by the department. That would be completely unbiased information, so consumers could go to that page and know, okay, I'm getting really clear information on what is a Medicare supplement plan, what does it cover? What is a Medicare Advantage plan? What does it cover? Information around open enrollment, because that's another issue that we hear about all the time. People,
It's in this bill.
yeah, people think that, oh, I've missed something, so I can't get out of my MA plan, or I can't enroll in a Med Sup plan. So our goal is to really try to put as much information out there to people. And then let them know, hey, if you need information, you should go to this site. So that's one area that we are currently working on trying to improve in Vermont.
So, and that was information you already knew, that at some point you'd be able to compare denial rates. I mean, I think Sarah Teachout yesterday said Blue Cross Medicare Advantage already files denial rates and some quality control information
With the department,
No,
On
but they're
Medicare
on their
Advantage?
website.
on their.
oh, they have it on their website?
Yeah,
Yeah, I don't think that.
I asked for that because I thought that would
Yeah.
be interesting.
Yeah.
But yeah, I think that's what people want to be able to compare. It's not, what does it say I'm gonna
Yeah.
get, but what am
What
I
am I
actually gonna
getting?
get?
Yeah. Yeah, and I believe a lot of that information is probably published by CMS, but maybe not in a really accessible way.
Yeah.
The previous
So-
witnesses said that CMS just put out a rule that said that those were going to have to be
Yes.
available in a
Yes.
year or so on a website,
Yeah.
so it's coming.
Yeah, CMS is starting to, there's a new rule coming out, new requirements. They are starting to get stricter around advertising and activities. And so you all know Vermont and the NEIC, which is the National Association of Insurance Commissioners, we are advocating for advertising oversight to come to the states.
Okay.
So that's something we are pushing for
Yeah.
nationally. To say, hey, we're already overseeing advertising for Medicare supplements.
Right.
And we're the ones who, mostly us and CHIP, the programs around the state, we're the ones getting the calls. So it would be really great if we could be the ones, overseeing the advertising, because I really do feel like that's where we see the most complaints and people, you know,
Yeah,
having a hard time.
everybody.
Yeah.
I guess the question, and we're going through this with
Yeah.
property taxes right now, is
Yeah,
how do you get that out to people? I mean, AARP, I believe, sells these programs and puts their name on them, so I don't know that they'd be helpful. Would it be Office on Aging? I mean,
it could be. Yeah.
how do you get the word out to people to know that they should go look at your website before they buy anything?
Yeah, so there's, in Vermont, and like most states, there's, federal funding that go to, I think it's the SHIP programs, which I'm blanking on what the acronym is now, I know what that stands for. Do you, okay, I just can't, I'll look it up, so I don't want to say what I think it is, but it's the SHIP program. So they get federal funding, and they're kind of frontline people who are taking calls on Medicare Advantage. So we've actually talked to them about and kind of started preliminary conversations with them about working with them on education and outreach. So, you know, once we develop these materials, we could work with them and making sure if someone's giving them a call, that they know they can either call us or they can go to our website. We could also work on putting out materials, physical materials, because not everyone's comfortable with websites. So there's a lot that needs to be done, and I'm the first one to acknowledge that I think we're not reaching enough people in our state on this issue. But it's definitely very top of mind and like personally a very high priority. So I think, but those are different ways that we could disseminate information and try to get this, information to people who really need it.
That'd be great.
So SHIP, which I can see how it's hard to remember, because it's SHIP, but it stands for State Health Insurance Assistance Program.
Yeah, there you go.
The A is.
Thank you.
This thing, cause SHIP is a nice word.
Yeah,
Yes, I was going through that and I had a feeling it was senior health
Yeah.
insurance. Something.
Yeah, that's what I thought I was gonna put.
Okay, so it is an assistance program,
Yeah.
federally funded.
Yes,
Okay, that would be good if we could do that.
yeah. Would you like me to speak to the open enrollment provisions in the bill or any?
Sure.
We can, okay. So last year, I think Emily Kosicki circulated it to the committee. We did a report, Act 99, on open enrollment. So we looked at what would be the impact of, a broader open enrollment period that currently exists. So right now, if you want to sign up for Medicare supplement insurance, you have to do so during, an initial eligibility period. So essentially, normally it's either 3 months on either side of your 65th birthday. So that's normally when you have to sign up for Medicare stuff. And this is if you choose original Medicare and then you say, I don't want to go on the Medicare Advantage route, I want to buy a Medicare supplement policy. And then you have that window of opportunity. There's a little variation, like if you're working past 65, the rules are a little bit different, but generally, you can think of it that way. And then, if you miss your initial open enrollment period and you go to sign up for Medicare Sup after that period, you can be subject to underwriting and a penalty, et cetera. There is one plan in Vermont, which I think you may have already heard about, offered by Blue Cross Blue Shield Vermont, that essentially serves as the insurer of last resort for Medicare Sup market, meaning that that plan is open to anyone at any time, if they want to sign up for a Medicare supplement policy. The caveat to that is that it's a more expensive plan, right? Because you have people maybe who didn't sign up for a Medicare supplement plan when they initially could, and then maybe they have a health event or change their mind, and that adverse selection, it's called, right? You're selecting against the plan can drive up costs. So that plan exists, and Blue Cross, we treat them as the insurer of last resort. I think that used to be a statutory provision, but it no longer exists. So I think the report supported the idea of adding that in, and I think Blue Cross supports that too. The broad stroke takeaway from our report was that it's really, aside from the under 65 population, and when I say under 65, I mean people who are enrolled in a Medicare supplement plan because of a disability. So they tend to have higher rates because they're usually experiencing other adverse health events. The impact of having a broader open enrollment period for Medicare sup and the impact that that would have on Medicare supplement rates, it's really dependent on the Medicare Advantage penetration rate in your state. So what we did is we looked at other states that had similar open enrollment periods and said, okay, what's happening in those markets? And what our actuaries saw was that it's not actually the open enrollment period that's causing the rates to go up for their Medicare supplement policies. It's the Medicare Advantage penetration rate. So we have a very low penetration rate, meaning we have a lower amount of Vermonters enrolled in Medicare Advantage than other states in the country, generally, not some states like Alaska, I think have very low rates. And essentially it's the states that have very high Medicare Advantage penetration have higher med sup rates. And that might be because, you know, the healthier people are in the Medicare Advantage, and that kind of leaves, you know, the folks in the Medicare supplement who are actually maybe using their health insurance to a higher degree, right? It's just based on them, you know, the kind of the breakdown. If you need your insurance, you probably want a more robust plan, or depending on, you know, what your healthcare needs are. What we did also find though is that for the under 65 population, creating an open enrollment period would have a greater impact on the rates for that group. I reread the report last night, so I think I'm reflecting that correctly. I'm getting a nod from Mike, so that's good. And so that's the population. We tend to consider them more vulnerable. They're on disability, you know, they're in a different situation maybe than someone who is retired or in you know, different financial situations. So that was a concern.
Right now we have low penetration, so
Yeah,
we have low, you wouldn't have that many people switching back, so it
Yes.
wouldn't hugely impact your rates. But we don't control to change that now. By next year or the year after, we could have much higher penetration.
yes,
And it's harder to take back something.
correct.
And
Yeah. And so the committee knows, I think since we wrote that report, it's like, I wanna say it was 27%, and I think we're up past 30%. So it's growing, yeah, it's growing in Vermont, so we expect that will be similar soon as far as the enrollment in Medicare Advantage of other states around us.
I think we heard yesterday, in Massachusetts,
Mhm.
from Cross, that they had open enrollment, but that their costs had gone up, but they are probably more highly, their plans now cost more than Vermont.
Their Medicare supplement
Yeah.
plans, I am not sure, but,
What we were told yesterday.
okay, yeah.
Okay. Okay, no broker taking, did you say address brokers not being able to take commissions on this?
Yeah, so we're preempted by federal law from setting
You
commission
can't say
rates.
we
We
can't.
cannot control that, the state level.
Okay. Okay, any other questions?
The commissions though are paid to the brokers
Yes,
based on rules at the federal level.
correct. Yep,
Are they standard national?
yes, they're universal throughout the country. Yep, and I believe they just put a cap on some types of commissions too. So the rules are starting to change, but I think some would say not quick enough, so.
Are brokers policed?
So under federal law, the insurers, the Medicare Advantage insurers are supposed to oversee the brokers they hire to sell their products. Are you asking if DFR polices them? So we don't actively go out and monitor broker activity. If we get a complaint,
That's the next
Yes.
question, is are you getting complaints, for example, because if we're concerned about Medicare Advantage in particular, is there misinformation being disseminated or that have resulted in complaints?
Yeah, so we do receive complaints. I think I cited to a number in the report, but a lot of them are people confused, right? So they've obviously received some misinformation along the way. We don't know if that's an ad. We don't know if that's from a broker a lot of the times, but they'll say, like one recently we had was, someone thought they had missed an open enrollment period for Medicare Sup, and there is no annual open enrollment period. So it's things like that we hear about. And we have to say, no, you're fine, you don't have to worry about switching your Medicare supplement plan, don't do that, right? But they obviously think, oh, I have to make a choice, right?
Yeah.
And that's because the advertising they're saying, they don't, I mean, how, like, they don't understand the distinguishment between what they have in the Medicare Advantage, so they're just, it's really confusing.
It is, I mean,
Yeah.
you've got A, B, C, and D,
Yeah.
and part this,
Yeah.
I think I've got everything, but I couldn't tell you what
Right.
each part is.
Yep,
I've got prescriptions, but I don't
Right,
know what
yeah.
that is.
yeah,
And I think that is confusing for people.
yeah,
And, yeah, okay.
So that made me wonder if you are given an advertisement that seems pretty false or egregious. Can you trace that to an entity that has a license in Vermont that you can revoke?
we should be able to, yeah, and I wouldn't wanna say, oh, you're this advertising without, so we're gonna revoke your license,
Right.
but we can look into it and say,
Investigate.
yeah, investigate, and another state I talked to, I guess, works with CMS on enforcement issues, so they can, you know, they go to CMS, say, hey, we found this, and then they kind of work in conjunction with them to try to investigate issues. I mean, we're also a very small department, so, you know, resource wise, like some of these other bigger states have
Yeah.
the ability to kind of
They have
go out.
insurance committees in the
Yes.
legislature.
Yes, yes,
Tell them
exactly.
everything this insurance
Yeah.
committee covers, and they just look at you.
Right, yeah.
So if you were, you don't need statutory language to enable you to do more of that. You would need position or resource.
Or resources, yeah, and I will say, just being honest, the federal rules are very complicated, we're in the process of learning, like, we're having discussions around what's allowed, what's not allowed.
Right.
Based on complaints, right, and so far, I think the ones we've looked into have actually been. You know, we received a complaint, and at first blush, we thought, oh, this can't be right, and then we looked at the federal regs and said, actually, they can do this. So it's been a learning process on our side too. The federal laws are very different from the laws that we're enforcing here in Vermont for advertising practices. So we're kind of on this road to understanding what's allowed to, and it's different. It's much, I think, more flexible as far as the advertising practices.
Can I stop? Yeah. You get revenue from the licenses?
Yes, they have to pay a fee, licensing fee. I don't know off the top of my head what that licensing fee is.
If it's not high enough, we've already raised it.
Yeah, and that applies to all insurers, right? It
Yes,
was
I
the
mean, fee,
MA,
fee thing. is-
yeah. MA plans don't pay a different fee than, or MA insurers don't pay a different fee than the health insurer, for instance.
Right.
Yeah,
I just didn't know if it follows kind of OPR format where the fee is supposed to cover the cost of insuring their.
well, from my time in legislative council, I think technically fees are supposed
Right.
to
That's what
be
you're
equivalent to the service provided, but that's a
Um,
whole other.
When that came up, the amount of money that comes
Yeah.
from the FR to this state, the subject has quickly dropped because we would be in very tough shape if we didn't get that annual transfer. And some of those are in the housekeeping bill this year because they want to keep more before, because to cover their costs. And that we could look at to adjust that percentage, might be a way to do it.
Yep.
Okay, any questions?
So could you allow me to say just a quick sentence from right here?
Yes.
Mike Fisher, healthcare advocate, I just want to recognize that
2 years ago, DFR and a whole group of stakeholders did a tremendous amount of work on
Yeah.
what became the Act 99 report. And I feel some responsibility because I think I asked for it.
Yeah.
And it's a really important report about the lay of the land for older and disabled Vermonters in health insurance. And I don't think the legislative committee has spent any time really looking at it. And so I just want to put a plug.
Yeah.
It's an important report. So I'm not sure this is the right committee. But
They're here. Well, we could look at, get copies and posters.
Yeah,
Okay.
yeah, you all should have it in
I
some
don't think
form,
we
but
asked for it.
I think we
But
proactively
probably
sent
to
it.
Health and welfare.
Yeah, I posted it.
Okay, you got it.
Okay, good. Yeah, and happy,
99 report.
Act 99, I'm happy to come back to and walk through, there's a lot of information. So happy to come back to and walk through any other pieces of it that you're interested in.
Okay. Any other questions? Thank you.
Yeah, thank you.
And Kirby, we finished up our first things a little early, so we started with Emily, and I apologize for a little late getting the review. But Emily fit in well with the first three witnesses, so. We are now going to go on to 181. This is the Community Media Public Benefit Fund. And if you remember, we had asked, rather than the poll attachment fee, to go to, are we doing an excise tax or a surge tax on, because there's a sales tax on community streaming services, right?
Kirby Gee, Legislative Council, yes, I have not worked on this, so I don't know a lot of background, but here to help and to figure out what we want to do.
Okay, Senator Chittenden, this was your idea.
So some concerns were raised about the poll attachment fees as a not necessarily the most direct way to compensate for the lost revenues that we're seeing from the public education government funds that have been traditionally collected from cable providers. And so one notion that came up was a more, I would say, comparable source would be to look at the content that is being sold and collected fees for in today's more TV over IP days of streaming content. And collecting from my understanding of the intent of the PEG fees from cable providers was traditionally to allow for local communities be able to have the capacity, capabilities, technical competence, and infrastructure to broadcast content. And so that's why cable providers would have to fund locally distributed resources. And similarly, I would say the Netflix, the Max, the Paramount Pluses that are all selling into our homes are generating this content in New York and Los Angeles and all over the other place, that it makes sense to me that they should be subsidizing and paying for the local capacity to be able to broadcast content here in Vermont. So that seemed to be where the conversation shifted from poll attachment fees to, I understand, and I'm looking at maybe if you want to correct me or not, we do currently charge a traditional state sales tax on streaming services. The notion, I don't know how an excise tax would be different on a streaming service as opposed to a 1%. I don't even know what that would raise. That's a big question I have, is what would a 1% additional sales tax, not a surcharge, but a 1% streaming tax in order to fund PEG sources would actually generate. So that's an open question for me. Feasibility of this and any reactions to this as an alternative funding source to a poll attachment fee. I think the negative, for what I recall in the committee discussion, is the providers that are stringing lines from the polls are paying sales, they're paying income tax, they're providing to the local economy. So to tax those providers already for what the services and work of the people on the ground in the boots up in the trees already are doing doesn't seem as valid to me as it is to assess those companies that are selling into Vermont without a physical local presence in Vermont. Is that what you're looking for, Sherry?
And we actually, yes, great. We also heard that there might be some conflict with federal law charging or taxing attachments or cable services. I think the logic with this is that they were getting a franchise fee from cable, but as streaming has ramped up, that cable has ramped down, and so the PEGs are not getting the same amount of money. So we figured we'd go after the streaming services, but we're not sure how or if we can do that.
I can provide some information to at least get the conversation started. So, as has been said, Vermont applies the sales tax to streaming services and to similar things like audiobooks, audio streaming, stuff like that.
Because I do pay a tax every time I buy an Amazon book.
So we are doing that. Vermont's also, as I assume the committee knows, a streamlined sales and use tax agreement state. So there's additional rules to conform to the agreement that Vermont would have to follow. The important one here is that Streamline has rules around how many different sales tax rates you can have. And just to give you an example, a member state can have one state sales tax rate and then a second rate that's lower for food and drugs. And then from there can be a local rate like what we do with local option tax. And then there's a few little exceptions here and there other than that, but that's basically the landscape. So whatever we do, if we want to stay in compliance with Streamline, which Vermont doesn't have to, but that's, a whole different.
Very helpful.
The streaming.
So I know this is confusing. I've done with the Streamline Sales and Use Tax Agreement, which is, it uses the word streamline, but it's this organization with, I think it's 24 states that have all grouped together to do their sales tax similarly to make it easier for businesses to comply with taxes.
This was prerequisite to getting the Wayside, the Wayfair decision. That they said business would do it, but not if every state had a different tax on different things and different definitions. And so you had to have the same definitions. If you remember, we had to go to them to get permission to go from feminine hygiene products to feminine menstrual products.
So
We need to stay within their perimeters.
So the easy thing would be to just have a higher sales tax for streaming, because we're already reflecting that. But unfortunately, if we don't want to have problems with Streamline, I think Vermont would have to go a different route. And I think it would require consulting with the Department of Taxes at least, who can then reach out to Streamline and figure out what's doable for an alternative approach. There are 2 states that have proposals that I'm aware of for a gross receipts tax on streaming entertainment companies. Massachusetts and New York. I looked at Massachusetts, it's fairly simple. It's a 5% assessment on the gross receipts of a streaming entertainment operator. It's just something that's proposed in Massachusetts. That's not something they do. An approach like that, being gross receipts, would mean it's a separate tax. It's not a spot part of the sales tax. Maybe something like that would be doable or a way to pursue this. But again, I think so, reaching out at least to the representatives of Streamline to find out how they would react to that was a good idea.
Refresh my memory, gross receipts tax, would that be on the company as to what they sell to the state and they just have to reconcile with us, or is this on each individual consumer's bill that they would see a 5% fee?
The way Massachusetts is doing it is the company would report to the revenue agency. Typically it's a biannual, it's collected twice a year. A biannual financial statement that reports its gross revenues derived in such period from the sale of streaming entertainment services to individuals and businesses. And in this case, it'd be in the state. So that's how it would be done. That information would be reported. And then if I'm following this correctly, the idea is that the department then would take that information and let the companies know how much tax is owed. But it's just for the services provided in that state. I think that's an important part of it.
That makes sense.
It's possible. What we
I don't
don't.
understand how that differs from the sales tax
Company would pay it,
as opposed to the buyer.
wouldn't be on my individual receipt reorders. They would just reconcile with us twice a year.
But I don't know whether Streamline would agree that it's different enough from sales tax. That's the open question.
We would have they would agree.
You said 2 states, Massachusetts not implemented. Has New York implemented this gross receipts tax?
No, there's just a proposal in New York. I didn't look closely at that one because it looked like the Massachusetts one was a good model, so I just looked this up today. But we could look at New York and see if there's differences or.
Is it a policy decision to make sure it's proportional to the tax on cable?
Let's see.
I mean,
That's
just,
a good question.
I forget how the cable one works, but clearly we're trying to say there's lost revenue from less cable. Is it who decides what's fair that people who are paying for cable aren't paying a different proportion of people paying the fee through streaming?
We do.
Yeah.
Right, I mean, so if it is a policy decision, I think it's important we try to create some purity.
And then there is how much money, we were told how much money would be raised by the poll attachment. But we don't know how much money the pay needs to survive, never mind flourish.
Do you know of any other example that we currently have in the state of Vermont that's comparable to a gross receipts tax? Do we do this in other circumstances? I'm thinking of like producer responsibility, and when you sell in electronics into the state, you pay a certain amount that we collect. That's not the gross receipts tax, that's.
There's some examples, some that come to mind that probably at one time I'm thinking more. The local taxes that are done, Rutland and Burlington that are outside of the lot. Those are collected basically based on gross receipts. Their receipts are reported to the city, and then the city bases the tax off of those receipts. It's gross receipts taxes in general are common in Europe, places like that. It's like an alternative to the sales tax. And even New Hampshire's isn't supervised tax. It's like functions like the gross receipts because that's how the businesses pay that.
Okay, so first question is, can you contact Streamline Sales Tax and ask them? Tell them your crazy finance committee wants to do this, and is it legal?
Do we still have like a representative to the stream? We always had like somebody who.
I
Like.
I can tell you about that.
Who is the rep?
The Department of Taxes has a representative, but there is a legislative representative.
Yeah.
And I believe it was Representative Young years ago, Sam Young.
Oh, I was like, which the front.
I don't think
Yeah.
there's a legislative
Oh,
person taking that role. It's completely open for the taking.
Nobody has probably.
Sounds like a good job, shouldn't it?
Go.
And
My friend Brian Kennedy down, that was an N-Coil.
Yeah, right.
Excel, he's
I
everywhere.
think it's fun, or there's some benefit. I mean, it's interesting for nerds, yeah.
I am a tax nerd, but listening to the Streamline meetings made me feel the serious. I've never got my.
Jeff Wilson used to do it.
People from all over the country arguing about some product and how it should be taxed.
Yeah. Yes, it's interesting when you get with a lot of other states, you realize how really strange we are. So anyway, okay, we'll do that,
Okay.
and then we'll see if we can find out what the budget is for, who's he, Lauren?
For Glendavidian,
Yeah,
it said this would raise 6 to 8 million with the full attachment fees, but I don't recall her testimony saying that that's really what they need.
No,
So
I didn't hear that.
I like what Senator Hinsdale suggested, like if we just use this to fill the hole that we used to get from the cable providers, because that's really where the money should
Yeah.
be towards.
Right, JFO should be able to tell us how to ensure the percentage is equivalent,
Yeah.
because I just think that would be fair barring any other considerations.
Okay, we'll do this.
I don't want to volunteer anyone. I could guess. I would guess Ted.
Yeah, I
Not
would get
voluntarily,
10,
but-
Maybe
with
it's
a
what-
misleading.
Say, can you email JFO and tell them we need Senator Hinsdale, you want to know what percent of a gross receipts tax on streaming services, how you set that tax to raise the equivalent amount of money that the pigs used to get from
Franchise fee.
the franchise.
It's a little more nuanced than that, just because. And I think it's a challenge. I don't know if it's just a percentage of the dollar amount, because cable offers different things than streaming. But if you paid 3% on $100 cable bill, and you have a $20 streaming bill, I would want to take the fee and divide it by 5. So that someone purchasing cable and someone purchasing a streaming service are overall paying a proportional
We're
percentage.
losing it because
Or a
people
mouse.
are cutting the cable and going to streaming
Right.
services.
Some people have cable, I don't know who they are, but they still pay a specific amount. And
Not a continued share that they used to pay.
They're paying the same amount individually, but there's fewer of them paying that
Right.
same amount.
so in one sense, yes, I'd love to know how much it would take to fill the hole. But in another sense, I wouldn't want to create unfairness that
Right.
one is paying more of a
than the other.
percentage.
No, we should have a balance there. We're picking up the people that are cutting the cable,
Right.
so they're not paying on cable, so they're paying,
Right.
and some people will be doing both.
And if we decide
That's their choice.
to increase both, we increase both, but we start on a level.
So we need to know from Lauren and Glenn how much the pegs need. Okay. How much do they need? What's their annual budget? And what they would like to do. You're running into that with schools.
If I could say one more thing.
Yeah.
I would think the gross receipts tax is consistent with what I understood about the franchise fee, so I'm intrigued by this notion to understand how it does fit within the streamlined agreement of sales tax with the other states. In that way, the consumers wouldn't necessarily see it on each individual bill.
I don't think it would, but it's good to check. Because we don't wanna do this and then find out we've messed up and have to undo. Okay. Okay. Anything else on this?
Sales tax would have been uniform. That's just what it's
About
supposed to be.
15 minutes. Any other one on this?
Speak.
Have we got what we want? Okay, Kirby can check that out and
Sure.
we'll see. Is the gross receipts tax the same thing as the sales tax? See if that would rock them at all. All right,
I'm not volunteering anybody, but if the last person we had on streamlined sales tax was Sam Young, I think we're missing out on really important conversations about cloud and junk food. I mean, it's really an important group.
well, they're just making sure the sales tax, if they aren't doing anything with cloud.
Well, I think I remember that that's where you could follow which states were implementing a cloud tax and what it looked like.
Oh,
and-
no, that wasn't so that. Oh, it's no, cloud tax is a sales tax.
Yeah, so
You're right.
you could stay up to date, but not just get numbers, like hear the conversation across states, and I'm volunteering Senator Chitwood to serve on that.
But that's not.
I did, but.
I think the committee on committees appoints.
We should have representation on it.
Yeah, it would be a good thing. Okay. Thank you. Committee, we've got 15 minutes. You want to take a break? We've been here for a while and we've had some people in testimony today.
So we'll go off.